Hello, everyone. Thanks for joining here. We've still got some people rolling in, but we do have some preliminary kind of things to go through before we get started. So we might as well just get started as people are rolling in. Thank you very much for joining us for another webinar. This one is on the GF Strong SCI NAV service. And this is the second part to it. So we're actually quite excited because it's now the new rollout for the community to be able to access this fabulous service, which is the first in Canada and second in the world. So very excited to be able to share it with everybody. My name is James Heckner. I am work for Praxis as a community liaison. And alongside my partner, Shannon Rockall, I'll pass it over to.
Awesome. Thanks, James. Hello, everyone. Welcome to our, I believe this is the 11th webinar that we've done on spinal cord injury education. And so happy to share, or to have the team at GF Strong with the NAV program to share about this exciting service. So just wanted to bring it back a little bit to why we're here and how we ended up here. It was about, I guess, well, it was during COVID that James and I, had connected, and me as a clinician, as an OT working in spinal cord injury, and James as someone with lived experience, recognizing that, there's a lot of people with spinal cord injuries that live throughout the province. And of course, all of the specialized care is for the most part in the urban centers and in Vancouver. Well, of course, all of us as clinicians know that that there are people living throughout the province with spinal cord injuries. And for people to travel to the Lower Mainland for, specialized appointments, sometimes 5-10 minutes long, but the travel is, they either can't afford it, don't have the transportation, at risk for pressure injuries, sitting, in vehicles, that kind of thing. For all of those reasons. And also the clinicians were asking for more information as well. They wanted more information and knowledge. They wanted to be able to meet the needs of their clients within their communities. So that's where it started, where James and I initiated the in-person workshops. And now it's evolved to some webinars, as well as we're still very happy to do inpatient workshops as well. And just to share that knowledge so that we can meet the needs of our clients in their areas, in their home areas. But having this program, so the NAV service, just extends that so much more. It extends it to increase the knowledge of the clinicians, as well as being an amazing resource for people with lived experience. So we're going to get started. And before we get started, I just wanted to do a land acknowledgement. That the land on which we're hosting this webinar is on the unceded traditional territory of the Silk Okanagan Nation. We acknowledge these beautiful lands in which we learn, work, and play. And we also know that many of you are joining from health authorities and regions throughout the province and potentially country. And we would welcome you to mention your territory in the chat if you would like to share. I'm going to pass it over to Emily now.
Thanks, Shannon, and thank you everyone for joining us. I'm really excited to be here and really excited to share more about community access to this incredible service. So as you know, us at Praxis, we are committed to ensuring that all of the learning opportunities that we're providing to you are of your benefit and are just, most valuable as we move forward. So I did take a moment to send the survey link in the chat earlier. So if you did have a chance to take a look at it already and complete it, thank you so much. If you're in a large lunch group watching this as a team, we also have a QR code up for you to be able to complete the survey. It would just be really great for us as a team to understand just how effective it is for our workshops and our webinars and what we're doing. And again, allows us to tailor the content to what you need most. So just wanted to get everyone set up with those survey links, and then we can jump right into it. I think hopefully that's enough time for everyone to either have the link or the QR code. So I'll have us move on to the next slide.
Thanks, Emily. We'll pass it over to Rachel at GF Strong. Thanks a lot, Rachel.
Yeah, thank you. And thank you everyone for joining. This is our SCI NAV's second webinar with Praxis. The first one was back in November when we first launched to clinicians, and also has a lot more background information on kind of the process and development of SCI NAV and why more information around like why it was created. So there is a recording for that if you're interested. And today we'll kind of focus on a little bit of what SCI NAV can support with and some case studies.
Sorry, Rachel, you're on mute there.
Whoopsies. Okay, we'll try that again. Okay, so yeah, SCI NAV is a province-wide pilot project, and it's led by GF Strong and supported by the Rick Hansen Foundation, SCI BC, and the VGH and UBCH Foundation. And the mission or goals of SCI NAV are to support and assist clinicians and clients around the province and Yukon, and support strengthen SCI understanding and confidence, and improve access to appropriate supports and services, improve transitions from inpatient rehab to community living, and build SCI clinical capacity across BC. So our team is made up of a physiatrist, Viet, who is joining us today, and the physiatry changes every month, but Viet had a big part in the development of SCI NAV. Myself, I'm the nurse on the SCI NAV team. Cynthia is the OT. Erin, the social worker, and Shannon, who's with me, the physiotherapist. And so on the next slide, we can kind of just go over what everyone can support with. Viet, do you want to speak to physiatry? I didn't know you were joining us, but if you want to, you're more than welcome to.
Yeah. So as a physiatrist, I would help manage like secondary complications, the common problems of spasticity, nerve pain, if there were challenges with worsening sensation or motor function, things that kind of get missed when people are in the community, or if they don't have access to a spinal cord injury physiatrist.
Great. And then, yeah, as the nurse, a lot of the what I'll support with is neurogenic bowel bladder, whether that be making some changes to a bowel or bladder routine, or if a clinician's reaching out for some support on resources. Also providing some education around autonomic dysreflexia, orthostatic hypotension, ways of managing it, and what to look for. And then just providing some general SCI resources and handouts on a variety of topics, just based on whoever's reaching out is looking for. And then physio.
Yeah, physio, we do a lot regarding exercise prescription, of course, and then we'll work kind of in conjunction with the physiatrist in sort of non-pharmacological or non-medical approaches to spasticity, pain, and those symptoms that often come with SCI. And we do, since there are so many incomplete people with incomplete SCI now, there's a lot of ambulation, bracing, fall safety, and we do a lot of seating and wound support. We work with the OT and kind of divide up the roles accordingly. Respiratory health maintenance, we do touch upon as well. And we have this new hand clinic that is being run out of GF Strong. And so we do, and along with the OT, of course, a lot of hand assessment and exercise promotion.
Yeah, and then occupational therapy, Cynthia.
Yeah, thanks. Can you guys hear me?
Yeah.
Perfect. So along with Shannon, OT works with other clinicians or with clients and caregivers around any kind of seating and mobility issues or other issues with equipment, supporting clinicians with doing a 24-hour surface assessment if needed, looking at upper extremity aids or assistive devices. So a lot of it is, sending information about different things that are available for people that they can order on websites, assistive technology ideas, a lot around skin and wound interventions, and then adapted aids to improve a person's independence and participation in different daily activities. And as well, it's not on the list, but we've had quite a few clinicians reach out to both physio and OT, where they've received a referral for a client or working with a client in the community who have recently been discharged from GF Strong, and they have some questions about their home exercise program or the equipment fitting, because often people leave GF Strong without their final equipment. So we can also help support that transition back to the community after inpatient rehab.
Great, and then social work.
Okay. Yes, thank you. Hi, everybody. So far for social work, we've gotten some referrals around navigating financial systems, a lot of PWD questions, people trying to understand if they're eligible, how to start the process. And then also even PWD appeals has come up, so people who've gotten declined or denied PWD funding. A lot of system navigation questions, different healthcare services like CSOL, but just even regular home supports, long-term care eligibility, private versus public systems, providing some psychoeducation on coping with spinal cord injury. I've been able to consult and do a bit of assessment to see where clients are at kind of with coping and what they might need as far as resources, whether that be peer resources or local counseling in their area or public system mental health resources. So kind of all the regular social work stuff, but with the focus on SCI. And we even did get an adult guardianship concern come up with our internal team. So I was able to consult a bit on how to navigate that system and process as well.
Great, thanks. And next slide. Awesome. So since we have launched, this is we did a phased approach for launching the service. So we first launched to healthcare providers in rural and remote BC, and then opened it up to GF Strong patients who had been discharged and started kind of introducing the service, as well as worked with SCI BC and the team there with the info line, and then opened it up more to healthcare professionals across the province and including the Yukon. And then just earlier this year, opened to patients and clients. So we are now fully launched and open to everyone across the province in the Yukon, patients and caregivers, as well as clinicians. And then how we can support or communicate through email, through phone, and then we can set up virtual consults, so over Teams, there at the very end we'll provide a slide with the contact information, but typically people will call or email first, and then we can, if appropriate or warranted, we can set up some sort of virtual appointment if that's better, with whoever is best to support the person reaching out on our team. Next slide. So for eligibility, there is no referral needed. So patients, caregivers, family members, anybody can just reach out and self-refer themselves. Just send an email Physicians, nursing, allied health, anybody can also reach out through phone or email. There is no referral needed. For criteria for eligibility, the patient must have a diagnosed spinal cord injury. Injury must be chronic and not newly diagnosed, and the injury must have significant functional impact. So bowel and bladder involvement and or primary use of a wheelchair. And then what SCI NAV is not, so we are not a replacement for a family doctor or a prescription refill service, emergency service, and chronic pain management. And with chronic pain, it's more of like a standalone. If there's like ongoing spasticity, neuropathic pain in the context of an SCI, that is something we can try and support with, but just chronic pain is a standalone. So this slide was just created to try and differentiate between the different services. So for patients with a brand new SCI or someone looking for inpatient rehab, that still goes through the admissions coordinator, and the contact information is there, as well as a link for the referral form for inpatient rehab. Same with outpatient rehab, you still go through the referral form. And that's more for ongoing support and complex seating in person, whereas SCI NAV is a virtual consultation service, and that it can be, there's the email and phone number, and yeah, just more for like in time clinical support of a chronic SCI. So yeah, if it's a newer injury or you're looking for inpatient rehab, outpatient rehab, that would still go through the referral forms and the process. And if you're not totally sure who to reach out to, you can always reach out to SCI NAV, and we can try and put you in touch with a more appropriate service if it's not something that SCI NAV can support you with. So for clinicians, the SCI NAV team serves as a key resource for clinicians. So we can collaborate with clinicians to provide SCI expertise to address client-specific issues, provide clinicians with much needed access to appropriate support and services, and just kind of help navigate the system with you so that the clinician's aware of what's available in their area, provide knowledgeable problem-solving support for SCI-related health issues, and again, yeah, just help kind of refer to certain rehab or medical services that are appropriate for the client and within their community. And for clients, families, and caregivers, again, anyone can reach out. There's no referral needed. And we can try to access and support with SCI education, provide guidance, resources, navigate the healthcare system, and kind of find certain supports or services that are available in their area, offer knowledgeable problem-solving support for SCI-related health concerns, everyday challenges, any questions that come up, providing just support for individuals, families, caregivers on what is available to them in their community, related to care, equipment, community supports, and again, when appropriate, helping to kind of facilitate some connections. So if they're in need of SCI specialized service, trying to kind of locate what's in their area, who's in their area, and helping kind of guide them through the process on how to get connected with the right people. And with SCI NAV, our goal is to work with the individual and their caregivers as well as the broader care team. So when someone reaches out, if a clinician reaches out, we can work directly with that clinician. We can help reach out to the client and communicate with them, and we can keep everyone involved as much or as little as wanted or desired. Sometimes, or a lot of the times, it's we've had allied health, so OT or PT reaching out, but it's something more related to bowel or bladder concerns. So as long as the client is aware and okay with it, I can reach out directly to them, and I will communicate with the OT or PT that I have spoke with them. And if the client and allied health member are wanting to kind of share that information, I'm happy to update the OT PT or whoever it was that reached out, or just communicate directly with the client. And when a client or family reaches out, we try and understand who's involved in their care. So who their GP is, their physiatrist, any home supports, just so we can better understand who's already involved and what kind of support they're needing. And by knowing who's involved, it helps us kind of identify any gaps or facilitate connections when appropriate. And we try to work with whoever's already involved to just promote that continuity and collaboration, shared learning around SCI care. So a few examples of what clinicians have reached out for, a recent flap surgery and just wanting some more information on how to progress time up in a wheelchair, differentiating between upper motor neuron versus lower motor neuron and what that looks like in the context of bowel and bladder. Looking for some support with equipment and setting up equipment and challenges with that. Having a client asking about MAID and just wondering who to direct them to. Programs in the community of the client for peer support. Developing pressure injuries and unsure of how to intervene or what to do in regards to like the time up in the chair or in bed and positioning. And client asking to use the standing frame, which they hadn't used in quite a few years, and just wondering how to go about that. Those are just some of the examples for clinicians. And then on the next slide are some community examples. So we've had people reach out asking for some sports and recreations activities that are available in their community, funding, what type of funding they can access, what type of exercises, pressure injuries not healing, adaptive aids for bowel care just to promote independence, options or alternatives for bladder management if what they're currently doing isn't working, frequent UTIs and catheter blockages, Peristeen, lots of inquiries about Peristeen and if it's something that could work for them and their bowel routine, programs in the community to just promote supports and peer supports, and then sexual health and if there is anyone that is available to speak with them regarding sexual health. This is just some of the, I pulled some of the numbers of what people reach out for. So the biggest thing has been bowels, so neurogenic bowels, and it can be anything from not having an established routine at all, or just maybe experiencing some changes and wondering how to go about that. Like I said, a lot of people inquiring about Peristeen and if it's something that could be beneficial for them. And then the next biggest thing has been referrals. So just not knowing how to go about seeing a physiatrist has been a big one, or urology, and how to get linked to certain people. Equipment, bladder, spasticity, and skin or wound prevention and management were kind of the next biggest things. And then coping, medication, funding, exercise, neuropathic pain. So all sorts of things that people have reached out for. So yeah, we have included a few, I think we have 5 case examples. So this one was a mom who had reached out and was concerned about her daughter. She had recently had a recent DVT, and the family physician wasn't sure when she could resume use of the FES bike and stimulation. So I reached out to our physiatrist, who reached out to the thrombosis clinic just for some up-to-date recommendations. And then the physiatrist was able to follow up with the patient's families and just share the guidelines and recommendations on kind of best practice and when to go about resuming use of the FES bike. This one was the outpatient nurse at GF Strong had someone kind of just pop by her office, but wasn't actively being followed by outpatients, and had some questions about bladder management. So she reached out to me to see if I could follow up. Once I was able to connect with him to ask more about his bladder, I was asking some questions and found out he had a burn on his leg from a couple weeks prior that wasn't healing well. From just our phone conversation with him, it became evident that he was having some systemic signs of infection. And he shared that he had a very poor experience with the emergency department and was very hesitant to go. I asked if he was willing to share some photos of the burn with me. So he did send them the following week, and I called to follow up with him just because they were looking, potentially there could have been some infection, and I was a little bit concerned, just especially with the symptoms he had described to me over the phone. I followed up with him. He was still quite hesitant to go to emergency, so I ended up having a 3-way call with him and his family doctor. And we just kind of reiterated the importance of having someone look at it and lay eyes on it, and kind of where our concerns were coming from. And he did end up going and was given IV antibiotics. He ended up seeing plastics the following day, and a week later had had surgery on the burn. And once he had been discharged and was home, I did follow up regarding the bladder management questions that he originally had, but he was wanting to trial some new catheters and would need multiple follow-ups. So it was something more appropriate for the outpatient nurse here at GF Strong. So we ended up getting him in to see her so that there could be some follow-up with the trial of new catheters. And this one, Cynthia, I think will speak to this one.
Sure, thank you. So with this one was actually handled by the OT who was working on the NAV team before me, Julie, before I came on board. But it was a referral from a client in a remote community who had been recently discharged from GF Strong and was questioning about needing some seating adjustments because they were quite concerned about getting a pressure injury from their seating position. So Rachel called and gathered more information from the family member and found out that the client's body weight had increased, the cushion was starting to break down, and that the wheelchair armrests were not supporting him properly or sufficiently. So in the end, Julie and Rachel, and I should say in this community, like in many remote communities, there wasn't any community OT in place. There was funding for one, but like many places, there's some vacant positions. And so Rachel and Julie were able to connect the client with a contracted private OT outreach service that the health authority was able to bring in, which we've realized that with different health authorities, underserviced health authorities, there are sometimes might be the potential to do this if there's no OT services available in their community. So although we may not have intervened directly through the team, we were able to connect them with the right services that was able to help them.
I will speak to this one. This was I was contacted through Rachel, passing this on to me. Community physio was seeing a gentleman who was 30 plus years post injury. We didn't have a lot of information about the gentleman because he was injured in Saskatchewan and had moved to BC quite a few years ago, but had not been followed well by the spinal cord community here in BC. He had himself purchased a standing frame, and the physio was trying to assist him because he wanted to try to stand. And I did a virtual assessment with the physio and this gentleman, and he had a lot of seating and postural problems in his chair. He was propping or having to use his arms to hold himself up. And when we looked at his range, he had quite contracted lower extremities. And I had a concern with him just directly going to stand because not that, I mean, often spinal cord people have bone density issues and they can still stand and weight bear if the range is not bad, but once they get contracted, they are at risk for fracturing. So we really recommended to try to see an OT for his seating more and to look more at exercise and getting out in his community more. He had felt quite shut in after COVID. And so we connected him with Spinal Cord BC and a peer group, and he was starting to have coffees with them. And he was also going to try a power assist to allow himself to get out and about more, which we felt was a healthier approach than focusing on standing, where there really wasn't a real clear goal, like spasticity management or pain management. He just had the standing frame and thought he would like to use it. And this as well was a referral from a private physio that was seeing a young woman who had been injured in the end of the summer, August, with a fracture of her low back. She had surgery and then was very quickly discharged. And she was standing, but she actually, as I met the physio and this young woman could, from the history, she had some lower leg weakness, and it appeared that she really did not have bladder and bowel control. And she had been discharged home without any bowel and bladder education. So it was a fairly significant struggle. She had 3 children. Her husband had had to stop working to assist her at the home. And so the entire NAF team really got involved. Dr. Vu saw this young woman. Erin saw her regarding her funding, Rachel for her bowel and bladder discussions. And she actually, following all of our involvement, she is, I think, next week, actually going to come as an inpatient here at GF Strong because there was just too much education and assessment that was required. And she was going to have a home to go back to. So, you know, when we're looking at bed flow, we don't want to have a bed blocked, but she wasn't going to do that. And so we're really feeling positive that this will be a good, relatively short admission that will hopefully help her a lot and help educate us about, you know, what's the best approach. And yeah, so that was a very positive thing. So we feel, you know, we can get it without patients, but even in patients. And I know Dr. Vu had some information she gave me a while ago that I think it's close to 50%. You can correct me, Dr. Vu, that a lot of people with spinal cord injuries, new spinal cord injuries, don't get to come to GF Strong. And so we hope as this service is going to be able to assist the teams and community caregivers and people living with SCI in managing
Can I clarify something?
Yeah.
So SCI NAV is not supposed to be for new injuries, but because this woman had never encountered rehab after having her cauda equina syndrome, we felt that it was appropriate for her to come to GF for nursing, for physio, for OT purposes and medical issues. But theoretically, if you have a new spinal cord injury, that should be seen by a physiatrist in the acute hospital or shortly after your discharge.
Yeah. Yeah.
Thank you.
But we're there if they fall off the cliff.
Sometimes, unfortunately, they do.
Yeah.
Yes.
Thank you. So this is just a few of we send a survey out to anyone that reaches out to SCI NAV. It only takes a few minutes to fill out and it is super helpful. So if you end up contacting us, please fill it out when I send it to you. But there is a spot at the very end of the survey that's optional to provide some written feedback, whether positive or constructive. So these are just some of the positive things we've heard about the program so far. Just being able to kind of reach out and have some access to information specific to SCI, bowels, peer support, connection, and yeah, just being like a connection for people to reach out to and kind of point in the right direction of where they can get support in their own communities. So yeah, just very helpful to kind of see how the program's been kind of received so far.
I should also just add in, Rachel, like you mentioned earlier in the presentation, that this right now is a pilot program for a couple of years. So along with the survey, we're collecting a lot of other data, which hopefully we can all package up and then try to support this as an ongoing program with continued funding. So that's why all this data is really important for us to collect as well.
Thanks. Yeah, so just a quick summary. Again, it's a province-wide service, so we can support anyone across the province and into the Yukon. Empowering patients and families. We want to support individuals living with SCI as well as their clinicians and their entire care team. Help to build clinical capacities when treating people with SCI. Improving access to appropriate supports and services, and enhancing transitions from inpatient to community living. And again, we are now open to all clinicians and all people across the province with SCI. And then just how to access the service. So you can send an email, scinav@bch.ca, or you can call the number. And then I don't know, are we going to do questions now, or do we want to, I know there's some more people speaking.
Maybe what we'll do is we'll skip through here, and then if there's questions, we can they can either leave them in the chat or
absolutely
answer at the end.
Oh, I can speak to this really quick. This was for clinicians. One of the things we're kind of working on is building a provincial database of clinicians who have some experience working with individuals with SCI. And so the goal is basically to identify any clinicians across the province that have experience and are open to being contacts. And I'm just kind of slowly compiling a database. So if you would like to identify yourself as a resource, you can scan the QR code. It takes you to Microsoft Forms, and then it just asks your health authority what your role is, OT, PT, nurse, etc. And there's a scale 1 to 5, and it breaks it down on kind of what your SCI experience is, and I can add you to our database.
That's great. Thank you very, very much, Rachel, and the entire team, NAV team at GF, for joining and contributing. We're going to get a little bit of lived experience from Anand Cannon, community member out here in the Okanagan, who has utilized the service and has had very favorable positive results. So pass it over to Annette.
That's what you say. Hi, my name's Annette. I'm just over 17 years now, 17 and a half years as a paraplegic, complete T7, T10, 11 fracture dislocation. I've been really healthy all the way along, been here looking after everything. Had a few of UTIs that you think are part of the package that we get. So I deal with UTIs with Cipro that I have at home. And I usually don't use it if I think I have a UTI, usually urine quality of bed or something, but I don't start any antibiotics until I become incontinent. And then usually that clears up really quickly with Cipro. I've had a couple other instances where it didn't, and I had to go back to Emerge to get on a different antibiotic to treat it. So back in October, I again thought I had a UTI, became incontinent, started Cipro, started to clear up, continued the Cipro, and then a few days into it, the incontinence became worse again. So then I thought, well, now I should probably go to Emerge and get a urine culture and stuff, which I did. The urine culture came back negative. They did blood work, which is all negative. The physician in Emerge treated me with a different antibiotic, listened to my symptoms, and again, it started to clear up. So it kept going on I ended up 7 trips to Emerge, 5 different antibiotics, 1 IV antibiotic. And one of the trips, the 4th trip in kind of thing, I came while I was at home. I was going to bed, did an intermittent cath, emptied my bladder, jumped into bed. By the time I got into bed, I was incontinent again, which seemed really weird. So after kind of cleaning myself up, I looked and it wasn't urine coming out from my bladder out through the penis. It was actually scrotal edema. So that I went right back to Emerge that night. And then it was, again, now what do we do? So I saw infectious disease doc, and she treated me with more antibiotics and or the same antibiotics, which I ended up becoming allergic to. And so they took me off of everything. And then the last time I went to Emerge, finally saw a urologist there who admitted me, put an indwelling catheter in, and kept me in for a couple of days to just take care of everything. Spasticity was getting way worse. And so after a couple of days in hospital, they did a quick cystoscopy and everything looked really good. So I went home, kept the catheter in for about 10 days, removed it. Everything seemed good. And then the same thing, incontinent again, back to Emerge. Blood work was negative, urine was negative, back to an indwelling catheter again. So then James had mentioned that there's this group out there in Vancouver, the SCI NAV program. And so I reached out, not knowing what information I would get. And they were able to look at all my information that I had and suggested I was waiting for urodynamics to be done. And so they suggest I also get MRI of my thoracic spine. So my family doc, after we discussed it, decided we should do a complete spine MRI just to check everything out. So we did that a couple weeks. So that was in February, I believe, or early March maybe. And that showed that I had a syrinx from T7 down to just below T12. So now that's where my level of injury is, T7. That's where I'm paralyzed from. So the question was, now is the syrinx causing these issues, or is it just a coincidence now? So I was waiting to see a physiatrist. That was going to be 8 months in Kelowna. So I messaged Rachel and said, hey, is this okay? But she was away, which is fine. And then, so they had a cancellation actually last week. And so I went in to see the physiatrist, and he was going to contact the physiatrist in Vancouver that asked to have the MRI done. My family doc actually also contacted Rachel to discuss where we were going to go as well. And now tomorrow, actually, I was supposed to have the urodynamics on Friday. They had equipment trouble, so I'm having it done tomorrow. And then the physiatrist here said he would let me know within 2 weeks of seeing him what we were going to do, whether this is just follow up now to follow up with the syrinx, or whether it is something to kind of fix, I guess, with my spasticity still being there. And I've had 2 episodes of incontinence just one time. Like urine's been cleared. Actually, one time I thought I had a UTI. It was cloudy. I coughed and I said, I'm going to the lab to drop off a specimen. Within a couple hours of going to the lab and dropping it off, my urine was clear. The urine came back negative. So again, don't know what to do. So then I was reaching out, and yeah, these guys did help me out as to where I was going to go or what needed to be done. And now it's just a matter of waiting for information, follow-up. I don't know if you have anything to add, Rachel, onto that, or
So, and what was the was it a pretty simple process just to be able to go through the NAV program, get quick feedback?
yeah, actually, it was very quick. I was surprised. I wasn't expecting it because when I first left a voicemail with Rachel, it was, and then she contacted me back the next day and said, and she had the ability to pull up all my information from Interior Health here. And so she took that information to the group for their meetings, either Thursday or Fridays, and how would I think? And then the next week she contacted me back again saying, this is what they would like you to do. So I contacted my GP and said, this is what they would like. And then I've been contacting Rachel with all the things I've been doing and the progress.
It's great. It's like a large team. Quick
And it
access
was,
to the team.
yeah, and it was even the guys, the physiatrists, when I talked to them here, they again said, we don't deal much with syrinxes here. So that's why, he reached out to the physiatrist in Vancouver to get, again, more information.
Mm-hmm. Dr. Vu?
Yeah, thanks for that, Anand. I just want to highlight how crazy challenging it is to get people to come to Blessin. I'm at Blessin right now, but it's in Vancouver, right?
Right.
So it would, before this, your family doctor would have to refer you to the Blessin Spinal Cord clinic, and then you would go on to our queue, and then it'll take, months for you to be seen in clinic. And then I'd have to reach out to your local physiatrist and your GP. And then that delay, who knows how long it would take, between 4, 6, 8 months. So hopefully this service, the SCI NAV service, will get just at least your concerns addressed. And then that coordination of care, I think we could not have predicted that it because we know, I know a lot of the physiatrists in the community. Erin knows the social workers, Shannon knows the physios. But if we didn't know an allied clinician or somebody in your local community, it would take a really long time to coordinate. But with this service in Vancouver, at least we can reach out to your local team and help to coordinate it. So I'm really happy, not that you have a syrinx, but at least it's being addressed and somewhat in a timely manner. So I'm really glad to hear that. Thank you.
Yeah, the timeline, I'm extremely happy with that, to have all of this kind of done that quickly. with the right guidance as to where we should go. I was surprised that my MRI actually showed anything, because everything, I've had ultrasounds, CTs, and everything was negative besides 2 small hydroceles bilaterally. And yeah, that was it that came back, but until the MRI.
Cynthia? Oh, sorry, Anna.
Sorry. No, I said, but is that syrinx the cause of what I went through? I don't know that.
Yeah,
ahead,
one thing
Cynthia.
that I just like to add is that our team, because spinal cord injury is what our team knows, and we've all had years of clinical experience working with this group of people, and we're familiar with the different services and service providers, that we can be helpful with connecting the dots for people and referring them to the appropriate people, or getting the same people to talk, give our ideas as to what we think might be helpful. One thing that I'll just make people aware of that we don't have any control over is wait times for services. So we can't, our team does not prioritize people to a different service. We can make the service aware of what's going on, but it's not an avenue for reducing a wait time for certain services either.
While we're
Thank
at
you.
it, there are some questions, James, in the chat
Mhm.
about what is the time frame for response? Rachel, 48 to 72 hours. I think, yeah.
1 to 48.
Well, yeah, I know I'm very eager and I like to respond very quickly, but as this service grows, I've learned that like a 6-minute response rate might not be feasible. Take this morning, for example, I think before like 9 a.m. I was like, oh my gosh, I have 6 new emails. Like I can't do this. So yes, my original answer from last September of like 5 minutes and you'll hear back from me is no longer the case. 48 hours, but I will try to be quicker than 48, but 48 max.
Yeah. And then the second question about can people with a neurological disorder but not spinal cord injury use the service? And unfortunately, right now, we're only funded to support spinal cord injury. I think we've heard from like the brain injury, stroke communities to see if that's available, and even like MS or ALS. Usually it would fall under the same umbrella, but for now, we can only address spinal cord injury. And then I'm not sure what the question about Botox to bladder, but I support it. I love intravesical Botox. I'm not sure who. Let's see, Alexis, do you have a question about that?
That might be a another webinar all to itself.
Okay.
I think that there's a lot of people that are definitely interested in it and obviously should be aware of
Mhm.
it. So, you know, that's definitely something that we should put on the list. And also speaking of that, thank you very much, Anna, for sharing your experiences there. And yeah, I mean, this is, and also I'm glad to hear that it's you know, a 48-hour response, because we know that this is going to be a very well used program. But um, Heather Lamb was also going to speak on behalf of Spinal Cord Injury BC and the info line, which we've got a few minutes here, Heather, but I'm also thinking we should probably do a webinar on, you know, SCI BC info line and the services throughout BC as well, because we never have enough time with these webinars with just an hour. So Heather, did you want to speak just briefly here for a couple minutes on the info line and how the info line can support with the SCI NAV program? Apologies for this.
That's okay. I was actually quite interested to hear about the development of the program. We are super excited to have SCI NAV. It's the program that we needed but didn't realize we needed until it started. And I've referred quite a few people, clinicians and now our members, to the program for those medical and clinical questions that we are not able to answer. We've got a lot of amazing information, which I'll talk about quickly, but for the specific clinical information, it's so wonderful to have that resource. So on your screen, you can see our contact information. It looks like it's a little bit muddled. If anybody has any questions about how to contact us, I can try and put it into the chat after I'm speaking. But basically, we have a 9 a.m. to 5 p.m. service Monday to Friday. And of course, we always respond to things that come in outside of those hours. We aim to respond within 1 business day. We don't require a diagnosis to contact us, and we take calls from people with SCI, related disabilities, family, friends, caregivers, clinicians, general public, pretty much anybody who has a question, and we will answer pretty much any question that they have. We'll do our best to find an answer, and we're quite proud of that 1 business day response, which is quite different from a lot of the other services that our members are trying to contact. So we'll go to the next slide. And we have a wide range of resources which have been developed by our peer members and by our connections with the clinicians in the province, including at GF Strong and some of the people working for SCI NAV. So we have a vast database of pretty much any type of information that's related in any way to spinal cord injury or disability in BC. We have a magazine that comes out a few times a year with articles about peer information, research, what's going on in the province, wide range of things that's available to any of our members, and it comes in a hard copy with our back issues online. We have a sexual health site, which is partly peer-led and partly clinical. Likewise, we have a Living with SCI site that has similar information. Our travel guide is everything you wanted to know about how to fly after injury, the step-by-step of how to check in, how to book, how to get onto an airplane, how to manage bowel and bladders on a long flight, all from our peer membership who have been through it. Our SCIBC Marketplace is one of our most used websites, and we do have a new platform that has been around for a couple of months, much more user-friendly than the previous one. No glitches that we know of currently, and it allows people to post items that they have for sale or to give away or that they're looking for. So any type of medical equipment or supplies, accessible housing, and accessible vehicles, those can all go there. Particularly helpful for people with limited benefits or insurance, or anybody who's looking to try and save a little bit of money on those incredibly expensive items. We'll go to the next slide. And that's just a visual example of some of the resources that we have. The ones on the bottom are the wallet cards for autonomic dysreflexia, pressure injuries, and bladder. Those ones are obviously developed with our clinical partners, so the information is valid, it's research-based, and we encourage our members to carry them when they go, well, anywhere, but particularly to the emergency room to try to provide the local medical professionals with that snapshot of knowledge that can literally save somebody's life when they go into hospital. Next slide. So Infoline, we have time built into our schedules to do a deep dive into the sometimes quite random questions that people ask us. No question is too big or too small. We've got the time to spend half a day or a whole day researching something for a person. And when we feel that the information that we find is of broader significance, we may end up doing a spin story on it or putting it onto our database. We always communicate that information with our peer staff as well, so that they can put the information out to our peer network if we find something that's of particular use. So we will take pretty much any type of question. We help navigate people through the healthcare system, through the financial options that are available, through finding accessible housing, recreation opportunities in big or small communities across the province. And we've got good partnerships with people across the province providing those opportunities. So if you have any questions about what's available, and if you don't have the time to research it, call us. We will do the research for you. We'll go on to the next slide, and very briefly on some of our other options that are available. So I know there's a problem with the slide. It looked fine on my end. I'm not sure what's going on. This is our peer coaching program. So it's peers helping peers. If somebody has a health related goal, such as maybe weight management or wanting to eat a little bit differently, our peer staff can help people through creating small achievable goals to work towards something bigger. Next slide is our peer support program, which has been around for many years. And that's, again, peers helping peers. We've got staff members across the province. We provide in-person and online opportunities, both for group events, educational events, and one-to-one support for people who are needing a bit more assistance. And the info line works quite closely with our peer support staff to make sure that people have the right information, as well as access to local peers who have been through something similar. And we can also help to connect people with somebody maybe who speaks a different language as their first language, if that's a barrier for somebody to participate. We'll move on to the next slide. So just a quick visual of some of the work that we do and the number of events that we have and where our peer staff are located across the province. Next slide. So this is one of our staff pictures from last year, and it's a visual representation of the fact that we actually know what we're talking about when it comes to disability and spinal cord injury. Roughly 50 to maybe 65% of our staff, can't tell you exactly what it is at this moment, have some kind of a disability, and almost all of those people are people with spinal cord injury. So when we say that we know spinal cord injury, it's because many of our staff members have personal experience and are very happy to share that. So if you have any questions about the program, my email address is there. I do respond quite quickly, and I can go through it in more detail. This has been a very quick overview, but we are delighted to have SCI NAV and to work in connection with that group to help people with spinal cord injury live better in BC. So I'll leave it there. Thank you.
Thanks a lot, Heather. That's great. Sorry, that was really quick, 5 minutes, and there's a lot of information. But here again, I'm gonna just mention we are extremely fortunate in British Columbia to have such a vast and active peer program through Spinal Cord Injury BC throughout the province, and cannot stress enough how much you learn from others, whether they're newly injured or veterans. Highly encourage any clinicians out there to try and promote and encourage their clients to get connected with Spinal Cord Injury BC and their peer programs. So thank you very much. We also have a post-op survey so that we can kind of gather some information here on the learnings from today and potentially future topics. If you could please take a moment to also fill out the post-workshop survey. It really helps us validate what we're doing, along with how we can support and use this platform for anybody and everybody to be able to promote spinal cord injury education and awareness for down the road.
Thanks so much to everyone for joining today. And thanks so much to the SCI NAV team and Heather from SCI BC for representing, sharing all these amazing resources that we have for people living with spinal cord injury throughout the province. We're looking forward to continue to provide these webinars to you. And if you have any requests or suggestions, then please feel free to reach out directly to James or I, and happy to provide more webinars coming up. Thanks to everyone for joining.
Thank you very much.
Bye.